Hello and welcome to the National Center on Response to Interventions webinar on Schoolwide Multi-Level Prevention System. My name is Katie Klingler Tackett and I will be presenting to you all today. The National Center on RTI has a definition for RTI that includes what we consider to be the essential components. You'll see in the first part of this definition, response to intervention integrates assessment and the intervention within a school-wide multi-level prevention system to maximize student achievement and reduce behavior problems. It is important to point out that RTI is a school-wide prevention system as opposed to pre-referral for special education, and it is multi-level as opposed to multi-tier. Although this will be addressed in more detail in later slides, it is important to understand that there are 3 levels of instruction in an RTI framework, and districts, schools, and states can have multiple tiers within those 3 levels of instruction in order to prevent school failure. The second part of the definition highlights the essential components of an RTI framework. The first component involves schools identifying students at risk for poor learning outcomes. We refer to this process as universal screening. The next component involves monitoring student progress. The third component referenced relates to providing evidence-based interventions based on students' responsiveness. It is not merely the delivery of interventions, but that there is a multi-level prevention system in which students have access to increasingly intense levels of instruction and interventions. The last component involves the use of data to adjust the intensity and nature of those interventions based on student responsiveness. In other words, there is an explicit, systematic process for data-based decision-making. Some people mistakenly believe that RTI is only about special education. It is important to remember that RTI is a school-wide, multi-level prevention system that results in data that may be used as part of the determination process for identifying students with specific learning disabilities or other disabilities. This is in accordance with your state law. In summary, RTI is a preventive framework. RTI is not the name for a pre-referral process. The intent of RTI is to improve outcomes for all students while providing immediate supplemental support for students at risk for poor learning outcomes. RTI may be a component of comprehensive evaluation for SLD determination, but that is not why we implement RTI. As you saw in the definition, the Center has identified 4 essential components for RTI. The multi-level prevention system, or the 3 increasingly intense levels of instructional support. The 3 levels are primary, which is your core instruction and curriculum; secondary, which is in addition to your primary, and provides support targeted to students' needs; and tertiary, which is also supplemental to the primary level, but it's more intense than secondary. The other 3 components that we have identified as essential are screening, progress monitoring, and database decision-making. The Center has developed a graphic to highlight the RTI framework. Many of you probably associate the red, green, and yellow triangle with RTI. In reality, the triangle does not represent the overall RTI framework. Rather, it only represents one component, the multi-level prevention system. The center graphic that you see on the screen now takes into account all of the essential components, and most importantly, the use of data to make decisions, often absent from the traditional RTI triangle. If you look to the far left, you see screening. To the far right, progress monitoring, and obviously at the bottom, the multi-level prevention system. The 3 outer components require and are necessary parts of data-based decision-making, which is why the arrows travel in both directions. If these components are in place, but data-based decision-making is absent, then RTI is technically not being implemented. If you look at the center ring, you will see culturally responsive, meaning the screening tools, progress monitoring tools, interventions, and data-based decision-making procedures all need to be culturally responsive. In the same ring, you will also notice the phrase evidence-based, implying all components are based on evidence. If these components are implemented through a cohesive model, we would expect to see improved student outcomes. I'm going to talk about the multi-level prevention system in more detail now. The graphic on the screen now depicts the progression of support across the multi-level prevention system. Although the field frequently refers to these levels as tiers, we intentionally avoid the use of this term when describing the RTI framework. We instead use the term levels to refer to the three prevention foci: primary level, secondary level, and tertiary level. Within each of these levels of prevention, there can be more than one tier. Schools and districts vary widely in the number of tiers included in their RTI framework. Regardless of the number of tiers of intervention a school or district implements, each should be classified under one of these three levels of prevention. This will allow for common understanding across schools, districts, and states. Within the three-level prevention system, schools may configure their RTI framework using 4, 5, or possibly even more tiers of intervention. In choosing a number of tiers for their RTI framework, practitioners should recognize that the greater the number of tiers, the more complex the framework becomes. For example, a school may have 3 interventions of approximately the same intensity in the secondary prevention level, while another school may have 1 intervention at that level. While there are differences in the number of interventions, these schools will have a common understanding of the nature and focus of the secondary prevention level. As we just discussed, when many folks think of RTI, they imagine this triangle. The graphic used by the center, shown in an earlier slide, incorporates all of the essential components of RTI, while this triangle represents just the instructional levels available to students, only one component of RTI. This triangle represents 3 levels of prevention and the percentage of students we would expect to benefit from those levels of prevention in an effective system. The first, or primary level, is indicated in green. We expect most students, at least 80%, to benefit from this instruction. It is important to note that when we refer to core instruction, we are referring to the instruction occurring for all students within the general education classroom. This should include whole and small group instruction, along with differentiated instruction based on student needs. The next level, or secondary level, is supplemental to the primary level, meaning that the secondary level does not replace the primary level. Rather, it is an addition to the core instruction. We expect about 10 to 15% of students to need supplemental small group instruction in order to benefit from the core instruction and curriculum. The top level, or the tertiary level, is also supplemental instruction to primary instruction. It includes specialized, possibly individualized systems for students with intensive needs. It typically involves small group instruction of 1 to 3 students who are significantly behind their grade level peers. Data represented in graphics like the triangle can help us determine the effectiveness of our prevention levels. If less than 80% of students are benefiting from the primary prevention system, you should consider focusing school improvement efforts on improving core instruction and curriculum. If there's a large percentage of students who require secondary or tertiary support, consider implementing large group instructional activities and system changes to address the needs of these students within the primary level. Typical tertiary interventions will not be cost-effective or address the overall problem that led to the large number of students needing tertiary support. Primary prevention level is the core curriculum. The core curriculum is the course of study deemed critical and usually made mandatory for all students of a school or school system. Core curricula are often instituted at the elementary and secondary levels by local school boards, Department of Education, or other administrative agencies charged with overseeing education. This is the classroom occurring within the general education classroom. In an effective primary level prevention system, the curriculum materials used for the core curriculum are evidence-based for the target population of learners. The curriculum materials in use are aligned with the state standards and have identified supplementary materials to specifically address alignment gaps. Teaching and learning is well articulated from one grade to another, vertical alignment, and within grades, or horizontal alignment, so that students have the same experience regardless of their assigned teacher. Most or all teachers use student assessment data and knowledge of student readiness, language, and culture to offer students in the same class different teaching and learning strategies to address student needs. And school-based professional development is institutionalized and structured so that all teachers continuously examine, reflect upon, and improve instructional practice. Secondary prevention typically involves small group instruction that relies on evidence-based interventions that specifies the instructional procedures, duration, which is typically 10 to 15 weeks of 20 to 40-minute sessions, and frequency, 3 or 4 times per week of instruction. Secondary prevention has at least 3 distinguishing characteristics. It is evidence-based rather than research-based. It relies entirely on adult-led small group instruction rather than whole class instruction, and it involves a clearly articulated, validated intervention which should be adhered to with fidelity. In an effective secondary system, interventions are evidence-based, that is, an intervention for which data from scientific rigorous research designs have demonstrated the efficacy of the intervention. It is well defined in terms of curriculum, duration, frequency, and length of sessions. It is closely aligned with the core curriculum and complements the core instruction. It is implemented using a standard protocol. Procedures are in place to monitor the fidelity of implementation of the secondary level interventions, and the preponderance of evidence supports that the intervention is implemented with fidelity. It involves teacher-led small group instruction where the group size is optimal for the age and needs of the students, and is in addition to the primary level prevention or core curriculum. Tertiary prevention, or the third level of the RTI prevention framework, is the most intensive of the 3 levels and is individualized to target students' areas of need. At the tertiary level, the teacher begins with a more intensive version of the intervention program used in secondary prevention. This can be done through longer sessions, smaller group size, or more frequent sessions. However, the teacher does not presume that this intervention will definitely meet the student's need. Instead, the teacher conducts frequent progress monitoring, at least weekly, with each student. These progress monitoring data quantify the effects of the intervention program by depicting the student's rate of improvement over time. When the progress monitoring data indicates the student's rate of progress is unlikely to achieve the established learning goal, the teacher then engages in a problem-solving process. That is, the teacher modifies components of the intervention program and continues to employ frequent progress monitoring to evaluate which components enhance the rate of student learning. By continually monitoring and modifying as needed each student's program, the teacher is able to design an effective, individualized instructional program. Tertiary level interventions are evidence-based. They are implemented using a standard protocol. They are more intense than the secondary level intervention and should be continuously adjusted and individualized to address the needs of each student. They include established learning trajectories for all tertiary level students. Progress monitoring data is compared to the learning trajectory to determine the degree to which the student is making adequate progress. And again, tertiary level interventions are in addition to the primary level of prevention. Data should guide decisions about changing the level of support needed for students to be successful. There are clear criteria and guidelines for placing students in each prevention level beyond primary. Screening, progress monitoring, and other assessment data are used to inform instructional practices at all levels, with the goal that instruction is effective with the vast majority of students served. Data are analyzed and decisions are made, and students receive appropriate interventions in a timely manner. Data should guide decisions about changing the level of support needed for students to be successful. Remember, changing the intensity is a two-way street. In cases where students are responding, teams may consider decreasing the intensity of intervention necessary. In cases where students are not responding or not making adequate progress, the team should consider increasing the intensity. Although a different intervention may be needed, that is not always the case. If student data indicates a student is making some progress, but not necessarily adequate progress, the database decision-making team may decide to change the intensity of support by manipulating one or more factors. For example, the intensity can be increased by changing how long the student is receiving the intervention each day. The intervention may be increased from 20 minutes to 40 minutes a day, as an example. The intensity may also be changed by increasing the number of times a student participates in the intervention. For example, the delivery of the intervention may increase from 3 to 5 times a week, or increase the number of times per day, from 1 time to 2 times a day. In some cases, the intensity may be increased by changing the interventionist. For example, some schools use paraeducators to deliver secondary interventions. The intensity of a tertiary intervention may be changed by using a content specialist, such as a reading coach, to deliver the instruction. Group size may also be used to intensify an intervention by decreasing the number of students participating in the intervention. For example, the team may consider reducing the group size from 5 students to 2 students in order to provide the students more direct instruction and opportunities to respond. In 2010, the Center released its instructional tools chart to help users determine the effectiveness of interventions used in secondary and tertiary prevention levels. On the left hand, you will see the program and the published research that was evaluated for that particular program. Study quality and effect size data are provided to assist consumers in evaluating the efficacy of specific programs. On the Center's website, there is an easy-to-use video to show you how to interpret the tools charts, as well as a user's guide. Implementing the RTI framework can be quite difficult and can take at least 2 to 4 years to get into full implementation. We recommend that you select and implement evidence-based practices and procedures. The tools chart available through the RTI Center can help you do that. You should also implement the essential components and identified framework with integrity. It's not enough to implement screening and progress monitoring with integrity. You also must ensure that the interventions, core curriculum and instruction, and data-based decision-making procedures are implemented with integrity. It is also important to ensure that cultural and linguistic and socioeconomic factors are reflected in the RTI framework and its components. On the tools chart, there is a column that provides information about how these particular tools have been used with different groups. Districts and school teams should continually evaluate the efficacy of the model and model components for diverse populations. If you need more information, please visit our website at www.rtiforsuccess.org. Please email any questions that you have to rtiwebinars@air.org. Again, rtiwebinars, all one word, @air.org. We will be having a live chat on January 27th from 2 to 3 p.m. Eastern Standard Time to answer any questions submitted via email, as well as any additional questions that come up during the online chat. We hope you will participate.